Hi, my name is Christian Hatley. I'm going to be talking about the West Nile virus and how the different forms that it transmitted and the symptoms that are seen in people who contract the virus. There are a lot of misconceptions out there about the way West Nile virus is transmitted. Some of the ways people may think that it can be transmitted is through person to person, from animal to animal, and also by eating birds or other animals that may have the virus. These are all forms that people commonly think are ways of transmitting the virus, but are forms that the virus is not transmitted. Again, a lot of people think that these are ways that the virus can be transmitted, but however, the virus does seem to follow a cycle, and that cycle is between mosquitoes and birds. And a mosquito can bite an infected bird and then have the disease with them. And after about another week, that mosquito can also bite another bird that may not be infected and infect that bird. And that is usually how the West Nile virus is transmitted. However, there are some cases where a mosquito does bite an animal like a horse or sometimes a human. And when this happens, the humans or the animals are called a dead-end host, and this means that the human will not be able to pass the West Nile virus on to another human, or the horse won't be able to pass the virus on to another horse, and so thus they are called dead-end hosts. So with that being said, a dead-end host like a horse or a human is called a dead-end host because when they are bitten by the mosquito, they do not have enough of the virus to transmit it to another human or to another horse or animal. And this is the reason why they're called a dead-end host, is because the virus does not continue to go further after a mosquito has either bitten a human or an animal, because they cannot transmit it themselves to another person. So like I had mentioned before, mosquitoes are the most common way of transmission of the West Nile virus. They are the ones that are easily accessible to the virus and are often around humans and animals enough to be able to infect others. And the reason why is because the virus circulates through their blood system for several days and then gets into their salivary glands, which allows them to transmit the disease easily. Here I have a map that I got from the CDC website that shows human cases of the West Nile virus in different states, and also animals that have been reported with the virus found. You can see here that the largest cases found are there in California, but it is also one of the largest states. And so as you look around at the map, you can find where you're from and see kind of how the prevalence of West Nile virus has been in the past. The West Nile virus can be transmitted in several other ways. These ways happen a lot less often and are not very frequent. They can be transmitted through blood transfusions, organ transplants, and exposure in laboratory settings. It can also be from mother to baby during pregnancy, delivery, or breastfeeding. There are many precautions set forth in the medical professions to prevent these ways of transmission, so they don't happen often. Now we're going to talk about some of the symptoms that people that contract the West Nile virus see. And most people who do get the West Nile virus, around 70 to 80%, do not develop any symptoms, and the virus will run its course in a few days without the host realizing it, and they will not have to have any medical attention to themselves. And a lot of times they won't even know that they had the West Nile virus from getting bit by a mosquito. In some cases, there are people that do have symptoms from the West Nile virus. About 1 in every 5 people that are infected do develop symptoms like a fever or headache, body aches, joint pains, vomiting, diarrhea, and rash. And most of these people will recover completely from these symptoms, but the weakness and the fatigue can last weeks or months after having the virus. In some cases, people who develop the West Nile virus do have severe symptoms. This occurs in less than 1% of the people who are infected. They develop neurological illnesses such as encephalitis and meningitis. and these can become very serious and at sometimes fatal. A lot of times these diseases do end in paralysis and are greatly impacted people who have these symptoms. Again, these do not happen in most cases.